Dr. Nair only.
Can you tell me about all the symptoms you've noticed, for example? Itching, rash, new birthmarks or moles.
White spots, frenulum.
How long have you been dealing with this? Does anything in particular seem to make the skin issue better or worse?
3 to 4 years, dryness.
Anything else in your medical history you think the doctor should know?
HPV.
Hello, I'm Camille, and I'm a moderator for this topic. I sent Dr. Nair a message to follow up with you here, when he is back online. If I can help further, please let me know. Thank you for your continued patience. Best, Camille, Moderator.
Hello, here is my sotry for Dr. Nair. I'm an uncircumcised male and I was diagnosed with HPV 8 years ago. My warts were located mainly in my pubic area, as well as a few at the bottom of my shaft. I'm 30 years old now, and have only had one small wart in the pubic area a few months ago, probably due to stress and heavy smoking. I've had a girlfriend for 5 years, we've had unprotected sex in between treatments. She currently shows 0 signs and has normal pap smears. They never had your typical cauliflower shape, although I did pick one once and it grew back with a slightly similar texture to cauliflower. All my warts looked identical to the following, and have had 100% success rate with cryotherapy. They would never grow back in the same spot. https://forum/images/4um/9675203D93614EP48E4A857A550C820CF66.jpg. Now my current concern, for the past 3 years I have had white bumps growing on either side of my frenulum, and on the breve, that look like white Tyson glands. I'll write in point form how they behave. Started with 3 really small white spots, 1 on breve and 2 on the right side. 3 years later there's about 6 to 8. They seem to have reached a certain stage and stopped growing/spreading. 6 of them are paired in twos, very close to one another. 2 of them look like joint. 0 success rate with multiple and vigorous cycles of cryotherapy, Candeline, and Aldera. After a cryotherapy session, they don't scab, or fall off, then regrow. The area just gets inflamed, turns red, then they turn white again. They are very dry, with foreskin retracted and a piece of paper towel in between the testicles and frenulum. After Candeline, they look like they're scabbing, shrink, then return to normal size only 2 weeks later. Aldera also inflamed the area, with the same results. They look much more white and worse after a shower, similar to the ones on my corona which are smaller. Somewhat flexible, and are more white when stretched. I punctured these spots gently with a sanitized needle before applying Candeline. This didn't help treatment as expected, and the spots never spread, unlike the one in the pubic area which multiplied. Also, considering they are located on my frenulum, you would think they would have spread in 3 years to at least the testicles or scrotum, especially after intense exercising/sweating. Or have even grown much bigger. I went back to the original gum/sexual health clinic that initially diagnosed me with warts and have been treating me throughout the years. 1 MD, 2 nurse practitioners, and a handful of nurses all said they were not warts, and just normal penis bumps or glands, and that warts usually have rough textures. I was still worried and went to a dermatologist to get a second opinion. He looked at the spots quickly with his portable dermatoscope and said it is warts. So now I have a conflicting diagnosis. I asked him how he knew, and he said that papules/bumps usually do not grow on the frenulum. After doing some research, I found this was only true to an extent. Here are some photos I found online that look similar to my current white spots, in order with the ones that look mostly similar to my case. https://www.rag.org.au/a.f.p /2013/May/penile appearance http://www.chestersexualhealth.co.uk/wp content/upload/2010/12stis.pdf http://medicaldictionary.thefreedictionary.com/hirsutoid plus papilloma plus of plus the plus penis http://wastefullpeace.blogspot.ca/2013/08/plasticsurgeryki.com/sexually transmitted diseases 2/ my current derm can be hasteful at times, usually rushes me out of the office before I can ask in-depth questions. His idea that stuff usually doesn't grow on the frenulum made me not confide in his diagnosis 100%. He also removed a mole once that he thought looked atypical, and it ended up being benign. Nobody's fault, as it's hard to tell sometimes. He also scared me by saying might turn malignant because they are not responding. During this time with my derm, I'd periodically visit the sexual health clinic, and had yet a different MD, 2 nurse practitioners, and more nurses inspect me. They all confirmed they are again not warts. One nurse practitioner was actually upset I've been destroying my frenulum for 3 years, and to just stop. This issue has been a mental struggle. I've asked my derm for a biopsy, but he said it's very invasive and similar to a punch biopsy we did for my mole. My city isn't the best for health care, all my friends are doctors/nurses and always recommend going up north to a more reputable city. Sorry for the lengthy response. Trying to give him a good synopsis. I have 5 simple questions for the doctor which I would like to attach in my next message. Also, please find attached my personal pictures of the raised spots. Questions 1. My mind tells me to believe my dermatologist, but so many other trained professionals have said it's not warts. The sexual clinic also seems like they would have more experience with STDs. They stated no wart has ever looked similar to one's my frenulum, and they see hundreds a day. But my derm made sense when he said warts can look like regular papules and be smooth and dome-shaped. I'm also aware warts can be different colors and shapes on the same individual. Who do I believe? 2. Is there a non-invasive biopsy that can be done without destroying my frenulum even more and leaving a scar? It's been 3 years, and usually takes over 3 to 4 months for the area to completely heal, with the help 0.05 cortisone for 5 days, followed with polysporin for weeks. I live very close to Michigan and am willing to drive somewhere to get a proper biopsy for closure. 3. Is it too much of a coincidence that my frenulum started showing Tyson glands or papules at the age of 27? Since I have HPV, it seems unlikely that this is just benign glands. However, I did not have white prominent papules on my corona until a couple years ago either. 4. Is it safe to have protected sex? I know it's unlikely, but I'm terrified the virus will be transmitted via fluids that seep out of the condom. 5. Why would the warts in my pubic and bottom shaft area be so successful with cryotherapy? My derm said it could just be different skin textures. Sorry for the lengthy question. I have booked 2 more appointments, one with another dermatologist, and one with a urologist. This is such a controversial diagnosis, and because mine don't look like typical warts, I can't get a straight answer. Look forward to hearing from you soon. Thanks. Val. Trying to attach my personal pictures but didn't work. Here is a safe download link: https://www.senspace.com/file/mb0uxer. Thank you.
Hello, this is Dr. David. I am reviewing your question now and will be with you momentarily. I downloaded your photos. Those look like 4 dye spots on the underside of your penis, and on your frenulum those don't look like genital warts.
Really? Look more like glands to me. I have 4 size spots on my shaft which look pretty identical to this. http://www.4dicespots.com/wp-content/gallery/examples of 4 dice spots/4 dice spots photos.jpg https://www.google.ca/search Q equals 4 dice plus spots plus shaft and source equals LNMS and TBM equals ish and sa equals X and ved equals 0 auquil ref 5 so we 3 on kayak 5 WQ underscore OSGB and by equals 1472 and B equals 817 hash and Girk equals OYRX JSIG X of some waiting for the answers to the questions I posted. Thanks.
These look more like regular papules or 4 dice spots. They don't look like warts. You can get a biopsy to check for warts. I bet it will be negative. You can biopsy around the area on the side of the frenulum. They are not cancer or malignancy. Yes, it is safe to have protected sex. The more doctors you see, the more opinions you are going to get, and this can cause more confusion.
You answered some questions, but not nearly as professional as I expected. Also, I was under the impression I would be helped by Dr. Nair according to the help desk. I'm glad you don't think they're warts, but this conversation has not been reassuring. Your lack of punctuation for a medical professional is also discerning and a sign of lack of online decorum. Thanks for your time.
Hello, thank you for requesting me. Apologies for the delayed response. I am not online much these days. Do you still require help with your question? Dr. Nair.
Hello, yes I do. Please read my story and view the pictures I uploaded to SendSpace. I have 5 questions, and may have some simple follow-up questions depending on your response. Thanks for getting in touch so quickly, Val. I have attached a second folder with personal pictures. Here are both download links: https://www.senspace.com/file/mb0uxer https://www.senspace.com/file/by6yap. Hello doctor, please disregard those links above. I have put all pictures in one folder to make it easier for you. Please note I'm not concerned about the glands on the corona. I've had these since my teens, but some have become more white and noticeable over the years while flaccid. https://www.senspace.com/file/88. Look forward to hearing from you. Valkyrie.
Thank you for the photographs. So I looked at all of them carefully, and I am quite convinced that these glands on either side of the frenulum are Tyson glands. As I'm sure you know, these are just normal bumps seen in some men and are basically ectopic sebaceous glands found around the penile head. Furthermore, there is no hard and fast rule that they cannot occur on the frenulum, They usually don't, but there are multiple variations in normal anatomy. To me, the bumps on the frenulum look exactly like the ones on the side, and hence all of these are Tyson's glands. Furthermore, you have said that they all behave in the same way as well. 4 dye spots look different and are extremely rare in this location, so are ruled out in your case. Please feel free to ask if you have any queries.
I'm glad you feel that way. I do have some questions I would like for you to answer briefly. Address: 1. My mind tells me to believe the dermatologist, but so many other trained professionals have said it's not warts. The sexual clinic also seems like they would have more experience with STDs. They stated no wart has ever looked similar to one's my frenulum, and they see hundreds a week. But my derm made sense when he said warts can look like regular papules and be smooth and dome-shaped. I'm also aware warts can be different colors and shapes on the same individual. He also used a dermoscope. Gum clinic did not. One of the MDs at the gum clinic also tried to freeze an obvious sebaceous gland, which I later just popped, so you can see the uncertainty I'm dealing with. Who do I believe? 2. Is there a non-invasive biopsy that can be done without destroying my frenulum even more and leaving a scar? It's been 3 years, and usually takes over 3 to 4 months for the area to completely heal, with the help 0.05 cortisone for 5 days, followed with polysporin for weeks. I live very close to Michigan and am willing to drive somewhere to get a proper biopsy for closure. But isn't true that sometimes a biopsy is inconclusive? 3. Is it too much of a coincidence that my frenulum started showing Tyson glands or papules at the age of 27? Since I have HPV, it seems unlikely that this is just benign glands that appeared later in life. However, I did not have white prominent pearly papules on my corona until a couple years ago either. Usually these things begin in your teens. 4. Is it safe to have protected sex? I know it's unlikely, but I'm terrified the virus will be transmitted via fluids that seep out of the condom. 5. Why would the warts in my pubic and bottom shaft area be so successful with cryotherapy? My derm said it could just be different skin textures. Is this true? 6. Part of me feels a CO2 laser would be my best bet right now. It digs in the skin more and is more accurate. Since cryotherapy was 100% successful with the warts in my pubic area, why not this technique on the frenulum? Sorry for the lengthy questions. I have booked 2 more appointments, one with another dermatologist, and one with a urologist. This is such a controversial diagnosis, and because mine don't look like typical warts, I can't get a straight answer. Just in case you didn't see the last link, I've added more clear photos. https://www.sendspace.com/file/ekadia. Thanks, Doctor.
1. A dermatoscope is in no way conclusive for diagnosing a wart. More often than not, small warts do have any distinguishing features. I use a high-resolution video dermatoscope in my practice on a daily basis. 2. A shave biopsy is a superficial biopsy that does not require any stitches and usually leaves only a very small or no scar. And it can help diagnose warts if typical features like coilocytes are seen. And yes, a biopsy is not foolproof. Warts can sometimes show nothing diagnostic on biopsy. Still, in doubtful cases, it is the investigation of choice. 3. PPP and Tyson glands often become first visible in a person's 20s. I get patients in their mid-20s all the time who have noticed PPP for the first time. 4. Yes, I don't see a problem with protected sex. HPV is not transmitted by body fluids, only through small abrasions and direct skin contact with affected area. 5. Two main variables here to comment: it could be the skin texture, the number of freeze-thaw cycles used by the doctor, how the body responded to cryo at that particular time. 6. CO2 laser is what I use for genital warts that do not respond to podophyllin. It is much more effective in removing warts in a single sitting as per my experience. However, there is a small chance of scarring and the procedure can fail for sebaceous gland-based problems like Tyson glands due to variable depth of the glands. So even if CO2 laser is considered in your case, it should only be after a biopsy. Hope this helps. Kindly consider rating our interaction to enable me to get credit for my work with you. You can continue to follow up even after if required. Thank you.
Thank you for the expeditious and in-depth response. I have rated you 5 stars and will follow up tomorrow. Internet is currently down until Thursday, North American Eastern Time, so I've been having to drive to a local coffee shop. I will have some simple follow-up questions, and a couple more photos. Thank you, Dr. Nair.
Thank you very much for the great rating. Sure, I'll respond ASAP once I see your responses.
I have uploaded a few more pictures for you. https:/www.sendspace.com/file/hu questions. 1. If I leave my foreskin pulled forward throughout the day, or over the night, the white spots are far more prominent. Much more moist and visible. If I retract my foreskin, they become flatter and less noticeable again. Also, if retracted long enough, they can become mildly flaky if played with enough. Is this behavior the same for warts and Tyson glands? 2. If they are indeed Tyson glands, should they be able to ooze with white liquid? I have sebaceous glands on the shaft, sometimes they can be popped if big enough. Is there a hard difference/symptom between the two? Please keep in mind the warts in my pubic area never grew or multiplied next to each other, they just stayed the same. 3. When should I be worried if these are warts? If they spread to other parts of the frenulum, multiply and become more irregular? If you notice in the new pics, some look irregular or joint. There's around 8 to 9 now that I can count. Can these Tyson glands get worse and multiply with age? 4. I am scheduled to see another dermatologist, as well as a urologist, because I feel a urologist may be more familiar with the glands and anatomy of the penis. If they confirm these are warts, should I just accept it? 5. You mentioned you have men in their mid-20s first realizing their glands. I have always noticed the ones on my corona, but on the left side they have gotten slightly worse, and especially if foreskin is left forward. I'm still very worried the ones on my frenulum would just appear at 27 years old. There was only 1 to 2 tiny dots, now it's 8 to 9 3.5 years later. 6. When I use Condyline, or Aldera, the spots are even more less noticeable. Is it normal for these products to also shrink glands, or should they have no effect at all? The fact that they disappear/shrink for a short time makes me think they may be warts. 7. Anything cream that can make these look less prominent? I may try apple cider and baking soda paste. Thanks doctor, that should be all my questions. Maybe one or two more after you respond. Number 1 and number 6 are most important. Also, am I able to follow up after my appointment in a couple months from now, or is that a new consultation? VE
1. All bumps will look different depending on whether they are moist or dry, and this change in appearance you have described could simply be because of that. 2. Tyson glands do no ooze liquid. 3. If bumps appear on the head of the penis, or the number of the bumps on the frenulum become more than 20 to 30 or become rough on the surface, then warts may be considered. 4. They should confirm these are warts based on a biopsy if possible. 5. As I said, new glands can be noticed with age. 6. I am not sure why this occurs, these do not have any effect on normal penile glands. 7. Only CO2 laser can help clear normal penile glands, nothing else, I'm afraid. Most welcome. If it's just a couple of weeks later and the follow-up question does not require much time, then please feel free to follow up in this question thread. Otherwise, a new question thread should be started. All the best and regards.
Thanks doctor. One last question before I follow up in a couple weeks. You say these are Tyson glands, aka ectopic sebaceous glands, but I thought sebaceous glands can be popped? I've had one on my groin, and one at the bottom of my shaft. They were rather large and I simply popped them with a sterilized needle. Also, how certain would you say these are not warts, i.e., 80%, 90%? Of course, this is only an online evaluation and not concrete. Thanks.
Sorry, just saw your last question. So even though they are sebaceous glands, they are not functional, as in they do not make any sebum. Hence they cannot be popped. It's very hard to put a number on it, but I would say I'm about 80% certain these are not warts. Regards.
Hi doctor, my specialist appointment is months from now, so I won't be able to follow up by then, so I may make another request for you down the road. I have two final questions. 1. Last time I did Aldera and Candyline I had contact dermatitis. My derm gave me a very light Desinide 0.05% solution. I used this lightly twice a day for 5 days. It helped a bit, but after that, it took 3 to 4 months for my frenulum go back to normal. However, the redness/scar tissue is always there. On good days maybe it is pinkish but still tender. I am experiencing the same thing again, but I feel I cause even more damage as the redness is on the right side of the frenulum also, and not just under the middle breve. I recently went into a chlorine pool/hot tube, this seemed to aggravate the area immensely. I've been using Polysprin triple ointment, doesn't do much. I read you recommend Cetaphil for everyday moisture, is this the best over-the-counter cream? Also, when I leave the foreskin pulled back, it seems to heal better. Moisture from foreskin makes redness appear again, almost as if it's ripping the skin all over again. What do you recommend for faster healing? Redness Picks https://www.sendspace.com/file/p69sjx2. Can candyline and aldera shrink a papule/gland? I read one of your comments saying it can really eat through/shrink most stuff, but in the end it will just return and create a disillusion. I was under the impression candyline and aldera would do absolutely nothing for the area. Am I overreacting to think these products could have just temporarily shrunk the glands? Thank you and take care. Pertaining to question 1, this or Cetaphil? https://www.aquaforest.com/healing-ointment/thanks. Also, I put candyline on the papules along my corona to see if it would have an effect. They were not visible for roughly 1 to 2 weeks, then returned. So whether or not a wart, there can be an illusion.
Hello again, 1. Cetaphil is a good general-purpose moisturizer, but for skin healing purposes there are much better products available, for example, Aven Cyclophyte Cream, Biofine Emulsion, Ariage Bariderm Repair Cream. You can try any of these. Aquaphor is also a reasonable choice. 2. Aldera/candyline both work by causing local inflammation and swelling. This can mask normal skin bumps like glands. The glands themselves are not destroyed. Once the inflammation clears, the bumps become visible again.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.